So the question when I was speaking to Beth, who I used to work with in ICU, was posing to me before, how do we develop leadership? This is a 2014 healthcare leadership framework that was developed in Australia called LEADS. Leading self, engaging others, achieving outcomes, drives innovation and shapes systems. Now this is a capability model, so you can learn this by mentoring, you can learn it by coaching or training, or doing something like a 360-degree assessment that you can check yourself against these frameworks. Other ways is looking at leadership styles, and if you're a leader, I really encourage you to look at the literature around the different styles. It shows you methods, characteristics and traits that make a good leader, and I've listed a number of them there. So let's just think about it just for today in a simple way and just in 3 different areas. One is organisational performance, and that was where all your fabulous, great clinical knowledge comes in. It's also where you can get some mentoring, how you can work out processes about how to get stuff done in the place that you're working, how to get resources, etc., who to go to, where to go to, who to email. But it's also that higher level thinking that's often required of a leader, that strategic thinking, innovations about what change do we need to innovate, what research do we pay attention to, and how are we going to make this change in the organisation. That's that segment. The other part down the bottom is the inner leadership processes. This is about getting to know who you are as a leader, your behaviour, your communication styles. And you can do this very easily by some leadership inventories. It's also about self-regulation that I was sitting over there just before I was coming on doing, managing my own emotions so I could perform just like you need to in your critical areas. Where this new model of leadership identities that I've developed fits in is this inner leadership process and how it interacts with other people. It's an interaction model that looks at how do we discuss things, how do we get other people to do things, how do we resolve conflicts, and how do we not start drama and conflicts as a leader. Because what you want as a leader is good outcomes, and when you can do that, your confidence as a leader builds. I left leadership in healthcare because I didn't think I had what it took, and that was in the, 1990s. And I don't want that to happen to you, because it's not your fault if you're a healthcare leader and you're struggling with self-doubt and lack of confidence. It's just that you just don't know how.